Hello, everyone. I hope you can hear me very well. My name is Olivia, and I'm happy to moderate the sessions today. So, as you know, our group is on the social protections, and we have amazing speakers today who we're going to work with. So, as you know, several studies and government have adopted more than 1,400 social protection measures since the outbreak of COVID-19, and these remain largely insufficient. So many people are excluded from the social protection scheme that are meant to support them and fall into poverty, compromising also their health and their well-being. So COVID-19 has shown a light on the need for more effective social protection scheme, including food, nutrition, security for marginalized and vulnerable groups. There's also a need to enhance data for better understanding and to address disparities experienced by adolescents, refugees, IDPs, migrants, and indigenous communities, people living with disabilities, and others. So we are pleased to have you today to discuss and talk about social protection that can actually help reduce poverty and inequalities in advance of the PMCH call to action, acts number 5 and number 6. So I'll go directly into it since we only have 45 minutes. So I'll start with Olivier. Olivier, thank you for coming. And please, if you want to take a minute to introduce yourself.
Hello, good afternoon to all. Olivier De Schutter. I am the United Nations Special Rapporteur on Extreme Poverty and Human Rights. In that capacity, I recently examined those 1,500 social protection measures adopted by states in the context of the COVID-19 pandemic and have been quite critical about the gaps that remain.
Okay, thank you, Olivier. So Olivier, you issued a very interesting report in September this year, during which, in which you review the social protection measure that have been put in place during COVID-19 and their outcomes. So can you please tell us what is the importance of social protection scheme, in particular in the context of COVID-19, and how successful have governments been in promoting social protection during this period?
Indeed, many thanks, Olivia. I think the figures on their face are quite impressive, right? The ILO has estimated that across 208 jurisdictions, about 1,500 social protection measures have been adopted to cushion the impacts of the crisis on the population. And that seems like a lot. They dedicated some $600 billion to social protection measures, but that is just a fraction, about 1/20th of the $12,000 billion that were injected in the economy through various economic recovery plans. But the key point I'd like to make here is that despite those figures, there are major gaps that remain. First of all, because many of these social protection measures were short-term ad hoc cash transfer systems without really being based on the recognition that people have a human right to social security and that support from governments should be predictable in the long term. And moreover, many of these measures have been miscalculated, leaving some groups out. Sometimes people working in the informal sector or in precarious forms of employment. About 2 billion workers worldwide work in the informal sector or are in precarious forms of employment, the majority of whom are women. Sometimes these groups have been left out. Undocumented migrants have often been left out, although some countries have introduced regularization processes to include them in support measures, including Portugal. And I say this because my esteemed colleague Catarina d'Albuquerque is here, but many states have not done the same. And finally, most worryingly, people in poverty have often not been able to benefit from social protection measures that were meant to protect them from extreme destitution. And that is because they are unable to fill in the forms online because they have weak access to internet, or they do not have the digital literacy it takes. It may be because they don't have the ability to provide the documentation required to prove that they fall under the categories that should be protected, or it may be that they experience shame or for other reasons do not wish to claim a right to certain benefits that the state allows them. And so what is very striking is that many groups are left out from the efforts that states have tried to deliver. Now, that is why the report calls for a human rights-based approach to social protection based on international human rights instruments, in particular Articles 9 and 10 of the International Covenant on Economic, Social, and Cultural Rights, but also on Recommendation 202 on national social protection floors adopted by the International Labour Conference in 2012. What it means to adopt a human rights-based approach to social protection is at least four things, and I summarize them very quickly here. First, it means that the relationship between the service providers, the public administration on the one hand, and the beneficiaries on the other hand, is not based on charity and on need. It is based on duty bearers having obligations vis-a-vis rights holders, and rights holders being able to claim benefits before independent bodies if indeed they're denied certain advantages that in principle domestic legislation should recognize them. And that removes the stigma, the shame from claiming benefits. It reduces the risk of corruption and discrimination, and it obliges governments to recognize the need to build capacity in order to allow people to effectively claim the benefits they have a right to. The second
Thank you.
I can discuss the other consequences of adopting a human rights-based approach, but the key point is we need now to make these provisional schemes permanent and ground them in a human rights-based approach. Thank you.
Okay, thank you very much. Thank you, Olivier. So Christina, if you can please take a few seconds to introduce yourself before I get into your question.
Yeah, thank you very much, Olivia, and greetings from Geneva. I'm calling you from the International Labour Organizations, and I'm responsible for social policy within the Social Protection Department of the ILO. So it's a pleasure to be with you.
Thank you very much. So Christina, Olivier just called for a human rights-based approach to social protection. So ILO is one of the lead organizations supporting these efforts. What are some principles or best practice in ensuring that social protection measures reach those that are often left behind?
Yeah, thank you very much, Olivia. Indeed, I mean, the ILO has always supported a rights-based approach to social protection in the kind of by now 101 years of the ILO's existence. And in fact, has not only supported a rights-based approach based on human rights, but the ILO has also a set of standards that have been adopted by the governments, workers and employers of the ILO's 187 member states. So let me just highlight some of the principles and best practices that are particularly relevant and complementing what Olivier has already said. I think one of the key points which is absolutely essential is to support a comprehensive and systemic approach to reaching universal coverage. So not having a very fragmented approach. And I think this universal approach is central to both reaching universal health coverage, but it's also essential for universal social protection. And Olivier has already mentioned also the important role of social protection floors, which are basically there to guarantee at least a basic level of social security. And this includes not only the income security part of it, but it includes also access to healthcare. So it's really a comprehensive approach. And we know that this combination of access to healthcare and income security is essential, not only for the determinants of health, but also for addressing the consequences of ill health. So having this comprehensive approach is essential. But we also know that, I mean, especially when we're thinking about reaching those who are left behind, there's quite often a kind of a certain kind of reaction to say, well, we have to go and for very targeted approaches. But this is actually something where we know from a lot of experience that the best way of covering those who are most left behind are not narrowly targeted and fragmented approaches, but it is really the inclusive systems. Because I mean, we know that social protection is a need that everyone has, at least at certain periods in their lives. And we also know that schemes for the poor tend to be for poor schemes. So ensuring the quality, ensuring the adequacy of social protection systems is best helped if we can design inclusive systems that can provide adequate and comprehensive coverage for all. And in that respect, it's very important to emphasize a lot the importance of risk sharing and solidarity in that. Because making sure, given that social protection systems represent an important part of the social contract, this emphasis on risk sharing and solidarity is really important. And that has implications for the policies, but it has also implications for the financing, ensuring sustainable financing, including fair and equitable financing mechanisms. And most countries are using a combination of tax financing and financing through social security contributions, through social insurance, to ensure this comprehensive approach that really can cover everyone and can meet everyone's needs.
Thank you so much. Thank you very much, Christina. Thank you. So we have Katarina with us. So Katarina, if you can please introduce yourself before I ask your question. Thank you.
Good morning, good afternoon to everyone. My name is Katarina Albuquerque, and I'm currently the CEO of a UN-based partnership called Sanitation and Water for All. And previously, I worked on the human rights, water and sanitation as special rapporteur. And I worked together with Olivier on many adventures.
Okay, great. Thank you very much. So, Katarina, inadequate availability of water. So, inadequate availability of water, sanitation, and hygiene is a critical contributor to poor health outcome. And this year, more than ever, we are seeing the impact of that. So, how should WASH efforts be structured to contribute to the UHC and better health outcomes?
Thank you so much, Olivia. Before I answer the question, I cannot resist the temptation and to echo what Olivier and Christina just said, and also to say that what is said is that that from our side, working on water and sanitation, we have seen exactly the same, that many of the good intentions and many of the interventions that governments have undertaken now as a response to COVID are, as Olivier was saying, are completely ad hoc. We have no guarantees that they will remain, and they are very often not targeting those who need them the most. And actually, if you ask me, they should have been in place already before, because it goes against, for example, let me take the human rights to water and sanitation. People should not be disconnected from access to water and sanitation if those services are not affordable to them for reasons beyond their control, because they lost their job, because they cannot pay the bill, because they are sick, whatever reasons. So these disconnections should never have happened. And how countries come with these ad hoc measures, to use Olivier's words, and they stop disconnections. Which disconnections are they stopping? Normally of people who don't live in informal settlements. Those, they need to purchase their water services from informal vendors, and those informal vendors are business people who still will need to charge for the water. So for those who are the most marginalized and vulnerable, even all these solutions or these provisional and ad hoc solutions are not even benefiting them. Okay, now I will answer the question, Olivia. So in terms of your question, yes, totally. If we want to realize the human rights to health, we need to also realize the human rights to water, sanitation, and hygiene. And we all knew that for a long time. COVID made it even more clear, and showing people that, well, that to follow the directives to wash your hands with water and soap, or to stay at home, that this implies that you have running water at home, that you access soap, and that you have toilets. How do we do it? How do we make sure that universal, that we build forward better to secure universal access to wash in a way that it contributes to UHC? And we think that it has to do a lot about integration and coordination. For example, our partnership launched a World Leaders Call to Action, where we made these links between water, sanitation, and hygiene, and other sectors, including health, social protection, work, economic recovery, and all of that. And I think that there were several heads of UN agency and heads of state signing it. Now this must be translated into actions at the national level. So these global commitments must be translated,
yes,
as I was saying.
Thank you, Katarina. Can you go a little bit slower, please, for the translator? Thank you so much.
Oh, okay. Because I feel under pressure by you to keep to the time. Okay.
No, it's very, very, very interesting. Thank you.
So I will continue slowly. So these commitments for a more integrated approach, as I was saying, must be matched at the national level. So what I think is that water, sanitation, and hygiene must be integrated, embraced, and featured prominently in domestic plans and domestic strategies, also to realize the rights to water, to realize the rights to health. And we can see that in some national plans and national strategies. For example, I'm just mentioning Chile or Brazil, but we can do more and we can do better. We ensuring that WASH contributes to achieving the right to health also means that the health sector should start at home. According to WHO and UNICEF, there are almost 1 billion people in the world using healthcare facilities with water, and 1.5 billion use health facilities with no sanitation services. So even if these numbers are already startling in normal times, in the context of COVID, they are deeply shocking and alarming. So upgrading washing facilities needs to be included in health strategies, in health budgets. So ensuring the prioritization of WASH within efforts to achieve universal health coverage is logical. We know how to do it. The big question is, of course, about political will, but we also know that when there is a will, there is a way. Thank you.
Thank you. Merci. Thank you very much. So, Katarina, so you outlined the required efforts to improve WASH. So lack of financing for WASH has been a real concern in the past. So how do we improve countries to make sure that the required investment, when they are losing trillions of dollars and have even smaller pie to divide across sectors? So how do we deal with that lack of funding for WASH?
Okay, I think that it's never enough to remember everyone that, as Olivier was saying, we are not talking about charity. We are talking about human rights obligations that are very clearly set out in international legal instruments that have virtually been ratified by all UN member states. There is an obligation to progressively realize economic, social, and cultural rights, among which we have the rights to water and sanitation, the right to health, among others, within available resources. So there is an obligation on states to make sure that they well, that they expand, how do you call it, available resources, right? From our side at SWA, we convened recently, this month and last month, meetings with ministers of finance to, and we managed to bring together around 70 ministers, including ministers of finance, heads of UN agencies, etc., in order to talk about the importance and the obligation to invest in water, sanitation, and hygiene, so that finance ministers create space and increase the available resources. So one of the things I would say, we also published this handbook for finance ministers on investing in water, sanitation, and hygiene. And what we say are 4 things, like Olivier, 4 things, and I hope that I will be able to say them all. So number 1, maximize the value from existing public funding. For example, better, and I will just mention one example, Olivia, that improving, for example, subsidy targeting. We know that the majority of subsidies are benefiting the rich and not the poor. In the area of water and sanitation, only 6% of the subsidies reach the poorest. So this is not a good use of public funding. Then, number 2, can I say number 2?
Yes. Very interesting, yes.
Okay, I will continue. Mobilize more funding by setting up adequate cost recovering policies. For example, reform the tariff system. We know that the tariff systems, existing ones, frequently benefit the better off, because the poorest of the poor, they are not even connected to the official networks. So they have to pay much more for water, sanitation, and hygiene. So when we all have cheap water at home, this means that the state is subsidizing my water while I am a middle or even high income person. So this is profoundly unfair, and this needs to be changed. And if the state does it, if they change and better target and the subsidies, and if they reform the tariff systems, this will make sure that the state has more, augments the pie that you were referring to, Olivia, and has more valuable resources to invest in WASH, but also in other social areas. Then another idea is to increase repayable domestic finance. This is a little bit more technical, but I can talk about it later if you want. And also encourage innovation and at least explore new approaches, such as, for example, climate funds. So we must also make sure that certain more invisible funding requirements are seen and are addressed. For example, creating an enabling environment within which the sector, and I'm talking now about water and sanitation, can strive. What am I thinking of? And where are we lacking investments? For example, strong legislative framework, good strategies, good policies that promote human rights, address corruption, address inequalities, ensure participation and transparency. Also the creation of and strengthening of strong accountability mechanisms. So I think that it often comes down again to political will. We all have a role to play in pushing for that political prioritization. We need to organize, we need to mobilize, to come together to make sure that the promise of the SDGs and of the human rights, and we just celebrated human rights yesterday, are delivered. I will stop here.
Thank you very much. Very, very, very useful information. Thank you, Katarina. So there are more questions to the chat. I will come back to those questions later. So just to go quickly back to Olivier. So Olivier, so you also pointed the difficulties that countries have in putting in place adequate social protection measure. Financing is one of those difficulties. So what are some of the other key challenges you have seen that actually prevent us from reaching the hardest to reach, and how do we address them?
Look, I think that this discussion is important. I think that the continuation of a dialogue with governments to make sure that as soon as they approve one of these emergency measures in the context of COVID, that there is a dialogue, that we write back to them, that, for example, and I think that the special procedures mechanisms of the UN, including the work that Olivier is doing, is crucial in order to ensure follow-up. I think that in our partnership, what we are doing, since we work with different stakeholders, bring them around the table, I think it is crucial that in these multi-stakeholder platforms that we promote at the national level, that we raise these issues with the governments in order to tell them, congratulations on what you did. This is a great first step, but you need to integrate human rights. You need to think of today, but also of tomorrow. There are measures that you are putting in place right now that should not be exceptional. They should be part of a core minimum of measures that you have in place. And number three, you must deliberately, number one, identify who the most vulnerable and marginalized are, where they live, which language they speak, which passport they hold, and then put in place measures that target them and not exclude or forget or ignore them.
Thank you so much. Thank you, Katarina. So, Christina, we have heard about the need to prioritize social protection. We have also heard about the current efforts, best practice, and challenges. So where do we go from here? From all of that, where do we go from here? And what should participants of this session prioritize as actions when they go home to enhance social protection? So Christina, if you can hear us, please go ahead.
Yeah, thank you, Olivia. I think the first point, and this is echoing what Olivier and Katarina have already said, I think the first point is really building and reinforcing social protection systems, and also obviously also the necessary provisions that are necessary for ensuring access to water, sanitation, and hygiene. So, and this is, and obviously also health systems. I mean, I think this all goes together. I mean, it's really part of the same story. And doing that in a way that ensuring that they're really anchored in human rights and international social security standards. And this really helps in addressing also the inequalities which we have seen so exposed now with the crisis. I think there has been a lot of emphasis on these kind of short-term emergency measures now during the crisis, but we have to go back now to the systems and see what has worked well. And I think there is maybe not enough attention on what has worked well. And I think in many countries there are examples of benefits that have worked well, but we have also seen the many cases where they haven't worked well. And I think now it's really the time to go back to the drawing board and see what do we need to strengthen, what do we need to improve, how can we make them more inclusive, how can we make ensure that those who are left behind are really included and covered, and not just included in receiving benefits, but also that they have a say in it, that they can participate also in the decision making, and so really ensuring also the participatory decision making. I think we need a second point is that we need a more comprehensive and integrated agenda for action. I mean, we have the SDG, we have Agenda 2030, but all too often we address it in a kind of siloed way. So we need to make much stronger effort to follow an integrated approach and to act jointly. And I think just one last point, being conscious about the time. I think we also need to look a bit beyond the social protection and the health systems and the WASH system. We need to, especially under the condition that we have as many countries have had to spend a lot, we have a risk of austerity looming. And I think it's important really to make sure that we're not just kind of thinking about going back to normal, but that we build back better, and that we really ensure that there is a human-centered approach to recovery, and that we're not just improving the health and the social protection and the WASH policies, but also look at the important linkages and the important connections to employment and labor market policies, to tax policies, to macroeconomic policies, so that we can really ensure that we can really improve and strengthen the systems so that they're more inclusive and more resilient than for more social justice and certainly also a much better social contract. Thank you.
Thank you so much. Thank you to all the participants. We are at the end of our session. Merci beaucoup pour les interventions. I see we have some French speakers among us. So thank you. Merci beaucoup tout le monde. And we look forward to continue this engagement and to make sure that no one is left behind. Thank you, everybody.